Eddie Kilbride with Kilbride Plastic Surgery. Today's patient story, the stellar propeller. This is the first in a series of orthoplastic reconstruction cases I'm going to be presenting, in which a multidisciplinary team is used to help manage patients with complex injuries. Most often orthopedics and plastic surgery, but also sometimes other specialists as well. So this is a 43-year-old who fell about 9 feet off of a ladder. He's otherwise healthy, he's a non-smoker, and he sustained these injuries. You can see a left displaced comminuted tibial fracture as well as a fibular fracture. And he was initially treated at an outside hospital, initially washed out, placed in an external fixator or frame, and transferred to our hospital for definitive management. Here he is at our hospital after his second washout, and this is what we would describe as a Castillo 3B classification of his open tib-fib fracture. So what that means is that there's a large soft tissue deficit with exposed bone, some exposed muscle as well there in the distal third of the leg as shown here. Now, you can see that the wound has been partially closed proximally and distally, but this defect is fairly sizable. And in order to perform definitive orthopedic fixation, my orthopedic colleague performed a lateral plate, which isn't shown here, but you can see this medial plate was necessary. They identified it's a medial tibial comminution, needed to place fixation there in the wound. So another element here as far as the consideration for closure. So here's the defect. It's clean. It's been definitively fixed by orthopedics and needs supple soft tissue closure. So a lot of ways to treat this. Traditionally, this would easily be in the category of free tissue transfer or free flaps. However, interestingly in this case, this patient had an active COVID diagnosis, an infection. This is in March 2022, so kind of the height of the pandemic. And there was reports coming out about hypercoagulability in patients with COVID infection. So I wanted to try and manage this with good definitive coverage without free tissue transfer if possible. Perfect solution here would be a propeller flap, hence the stellar propeller. So here are my markings. You can see the X's, which are posterior tibial artery perforators to the skin. Fortunately, there was no undermining up there, so those perforators were intact and verified on Doppler. You can see the flap design and kind of an oval shape is outlined there. Now here's a transverse view. So the knee would be on the left, the foot would be on the right. And what you can appreciate is that these perforators often emerge in this kind of septal plane between the deep and superficial posterior compartments of the leg. And that was the case here. And you can appreciate this zoomed in view in surgery as I'm elevating the flap. I had to take a picture. It's beautiful anatomy, 2 beautiful perforators from the posterior tibial arterial system. The flap is then completely islandized, meaning it is completely separated from its surrounding skin attachments, isolated on those 2 perforators, and flipped, in this case, a full, basically 180 degrees. So let me illustrate that. So you can see point A is marked on the proximal part of the flap. That point A is then spun around a full, basically 180 degrees as shown here, inset to cover that hardware, close that wound with good supple tissue. There's that point A as I've shown here. So this diagram just kind of shows how that flap is mobilized into the defect. Now here's the final result on the table. You can see beautiful perfusion of that flap on those perforators. There's no evidence of ischemia or healing problems there. And I put a split thickness skin graft over the donor site from his thigh. And that's what's shown there. So here he is at 1 week. You can see the flap looks beautiful. It's pink. It's covering the wound nicely and protecting that hardware, protecting the bone, etc. Skin graft is healing very nicely. Here he is at 3 months. This is my most recent follow-up. Good, supple, stable coverage. He's actually ambulating at this point independently, but with a cane, but doing quite well. And here's just showing his motion of his ankle with plantar flexion and dorsiflexion, so good mobility. And he got back to full independent ambulation without a cane by 6 months. So I hope you enjoyed this case of the stellar propeller, a nice illustration of orthoplastic reconstruction and collaboration. As always, make sure your surgeon's board certified. Ask for pre-op and post-op pics. We'll see you for the next patient story.